Assalamu alaikum viewers, I'm Dr. Fatima, nephrologist, Bardem Hospital. The topic today I'm going to discuss is diabetic nephropathy. Diabetic nephropathy is a disease of kidney which develops after long-standing years of uncontrolled diabetes. Whenever a life goes through without controlling diabetes for several years, there are certain changes that develop in our bodies. Several organs of our body, such as our eyes, heart, kidneys, and blood vessels, undergo some permanent changes. And the changes that occur in our kidney is called diabetic nephropathy. What happened to these patients? This patient loses protein in their urine. From the very early stage, in case of type 2 diabetes, which occur or happen usually in the older aged or adult people, at the time of diagnosis of diabetes, and in case of type 1 diabetes, which occur or happen in the younger people. In both cases, we suggest that we have to screen the patient for losing protein in their urine. If we can find it in the very early stage, that is called microalbuminuria, we can halt the progression of the disease. We have to remember that once the changes starting develop in our kidneys, it cannot be reversed back. But what we can do is to halt the progression by well controlling the diabetes and also the controlling this loss of protein in our urine. Whenever over several years the protein loss is increasing over times, and the diabetic nephropathy stages goes up. There are 5 stages. In the early stage, there is incipient nephropathy or microalbuminuria. In that time, the patient don't have any symptoms, but over times, when there is overt nephropathy or when the protein loss is more than 3.5 gram per day, the nephrotic proteinuria patient develop. At that time, the GFR starting to decline, and the patient starting develop symptoms over time. And ultimately, patient to develop end-stage disease, and the dialysis is the ultimate fate. So, for halting, if we want to halt this progression of this worldwide pandemic diabetic nephropathy, what we can do is screening our urine and screening our blood serum creatinine level once in every year after diagnosis of diabetes, in case of type 2 diabetes, and in case of type 1 diabetes after first diagnosis after 5 years, after 5 years. So these two things, the increasing serum creatinine and the increasing albumin in the urine, are the hallmark of diabetic nephropathy. So as a kidney specialist, I would like to request you all that if you have diabetes over several years and you are not going to till now you didn't tested your urine, please come and visit me to test your urine, that whether your kidney is at good condition or not. Thank you.